My name is Nicholas Mutale. I work for Lions Aid Zambia as Executive Director.
My name is Patson Tembo. I run the project in Zambia. I'm a country manager for Operation Eyesight Zambia.
My name is Fale Samboko Mungule. I'm the country manager for One Sight Zambia.
My name is Francis Kalusa. I'm program manager for Sight Savers, Zambia country office.
My name is Godfrey Mwelwa. I'm country director for Vision Aid overseas in Zambia.
My name is Luciana Duff. I am the country director for Orbis International Zambia.
Lions Aid Zambia is a developmental agency for Lions Clubs International District 413 Zambia. We have 5 objectives. However, today I wish to dwell on one. As you may know, preventing blindness is one of the flagship programs of Lions. Lions Aid Zambia is therefore working in partnership with the Ministry of Health in supporting interventions to combat eye disease through creating infrastructure to improve eye care delivery, increasing the number of trained eye care professionals, and making vision care more equitable and sustainable.
The core business of Operation Eyesight is that it has been around for the past 57 years. It's an NGO that is based in Canada, and we have our presence also in South Asia, Kenya, Ghana, and Zambia. In Zambia, we are in the 6 districts of Zambia, which are Lusaka, Sinazongwe, Kapirimposhi, Mukushi, Luano, and Ngabwe.
One Sight is an international non-governmental organization with headquarters based in the United States of America. The organization operates in various countries across the globe, and its main goal is to build a future where access to vision care is no longer a barrier to human achievement and potential. Our purpose being fueling people's potential by helping them see clearly.
Sight Savers is one of the leading NGOs that has been supporting eye care in Zambia for some time. We work with partners such as the Ministry of Health. So our core business, when we look at Sight Savers, is actually the prevention of avoidable blindness. But we do understand that there are certain areas where people could have gone blind and there are other disabilities. So we advocate for inclusiveness. So in a broader picture, I would actually say Sight Savers is an organization that aims at elimination of avoidable blindness, while at the same time advocating for the rights of persons with disabilities so that they are included in the development process.
Vision Aid Overseas is a UK-based charity whose focus is to increase access to eye care services, and that way you reduce poverty among the people, because our vision is no one should have poor eyesight because they cannot access it because of poverty, or no one will remain poor because of poor eyesight. So our main focus area is to reduce poverty by increasing access to eye care services.
Orbis International is a non-profit organization that works in Africa, in Asia, and Latin America. We are headquartered in New York, and our vision is to transform lives through the prevention and treatment of blindness. In Zambia, Orbis has been working here for the past 10 years, this being our 10th year, 2020, which is a special year. And we have our projects in Northwestern Province, on the Copper Belt, as well as here in Lusaka. Our main purpose and our key area of work is to provide technical support to the Ministry of Health in providing quality eye health services.
Partners such as ourselves continue to mobilize resources to complement these efforts. we have witnessed an increase in communities and vulnerable constituents accessing these services provided by trained professionals delivered in conducive environments with modern technology, such as the Lewenika General Hospital and Kabwe General Hospital eye departments, to mention but a few. We draw our comfort from this that indeed hope is in sight.
We have established an eye department at Baoleni, an eye department at Chawama, first level, and also another eye department in Mandeve. And these have a link to UTH, where the people that are picked from there will be sent to UTH for further management. So, in essence, we have integrated eye care into primary health care in Lusaka. Great achievements that we have done in this country is that we have eliminated trachoma on a sustainable basis in Sinazongwe, where we moved in when the trachoma prevalence was 14.4%. Now it's sitting at 2.1%. And there has been impact assessment and other assessments to verify whether it's sustainable. And all of them have proved that the trachoma has been eliminated. In the 4 districts of Central Province, we did what we call mass drug administration for 1 year, and when the impact assessment was done, we have found that we have eliminated trachoma in the 2 districts of the 4.
In partnership with the government of the Republic of Zambia, through the Ministry of Health, one site has implemented a sustainable model program through establishing 27 eye units in government hospitals. Allow me to also inform you here that 11 more eye units are to be launched by the end of this year, 2020, which will make a total of 38 eye units. Further, post the year 2020, we have plans to launch more eye units in this country. So we provide equipment for refractive error eye examinations and offer affordable glasses that are ordered by the established eye units through a cloud system that is linked to the National Optical Laboratory located in Lusaka. In this partnership, the government has provided space in targeted hospitals as well as trained staff that operate these eye units.
So as site savers, we've been contributing to the people that are receiving the classes. Other than that, we do understand that human resource for health is a key component. So as site savers in the project target districts, we've actually been supporting the training of mid-level staff. These are ophthalmic nurses, ophthalmic clinical officers, and these have now been trained and they've gone back to their districts and they are providing the services. Other than that, we do understand that training without equipment and consumables creates a gap. So we've also been supporting them with eye care equipment for them to actually undertake the various activities that they need to implement, as well as we've been providing them with drugs which they should be using during the surgical operations, during the outreach activities. We've also realized that health service delivery, when you're talking about universal health coverage, you have to reach everyone. So we've actually been supporting the Ministry of Health through the different partners, district partners that we've been working with motorbikes, so that they're able to reach even the remotest part of the country. Remember, I said site savers would want everyone to access the services, regardless of age. It could be color, it could be disability. Everyone should be included. The women will need to be reached.
So Vision Aid Overseas realizes also that effective eye care is dependent on the availability of qualified and more motivated staff. So we have contributed to the provision of eye care professionals, and we have done that through different strategies. We have supported the Chainama, the establishment of optometry course at the Chainama College. we conduct almost on an annual basis refresher courses through our professional volunteers who come in the country to conduct 6 weeks optometry refresher courses, mainly for ophthalmic nurses and ophthalmic clinic officers. So far we have trained over 159 staff through this program. We also organize optometry conferences. So far we have organized 2 as continuous professional development, where optometry practitioners are given an opportunity to discuss and share experiences around uncorrected refractive errors.
Our investment in eye health in Zambia for the past 5 years has been approximately about $6.5 million US, and this has included training, so training for ophthalmic staff. It has included what we term as hospital-based training, the traditional way of training, where we've sponsored ophthalmic staff to go to school and specialize. We also have procured equipment. We've procured medical supplies for our health centers that we work with. And also a lot of it has also been invested in community mobilization as well as engagement.
The advent of COVID-19 has brought to the fore different challenges in the delivery of the project. Limiting mass mobilization through outreach services and disruption to supply chain has had negative impact on accessing set objectives. We are alive to the fact that this is a fluid environment, and as such, Lions will continue to adapt its projects and ensure adherence to public health guidelines.
Though we have been working in Zambia for a long time, there has been a lot of challenges that we have faced. And most of the challenges is human resource. There are so many people that are trained in eye care, but they are based in the urban areas. But then eye care or eye disease is not only in urban areas, it is also in the rural areas. And we have also seen that apart from this expertise in the rural areas who are managing big hospitals, we need what we call mid-level cadres who are supposed to be based at community level to address some of the issues that people face without going or referred to bigger hospitals like UTH or Lusaka.
On challenges, like any other organization, one site has been impacted negatively by COVID-19 pandemic. The organization has, however, used innovative ways to ensure that major planned activities for 2020, such as launches of new eye clinics, are implemented while adhering to national health guidelines on combating the pandemic. Other challenges are difficulties to access communities in the remotest parts of the country in terms of conducting outreaches, poor internet connectivity, which delays transmission of patient orders through a cloud-based system, and lastly, there are few biomedical engineers specialized in eye care equipment, and these are critical to the sustainability of the program in terms of servicing and repairing equipment.
During the implementation of these activities that I've mentioned about, of course, there is the successes, but we also have challenges that we actually encounter during the implementation. You know, climate has become unpredictable now. So you actually plan activities somewhere maybe around October. You'll be amazed that if you go to the northern part of the country, like Mchinga, you start receiving rains as early as October, November. So meaning most of the areas become impassable. Most of the areas are cut off, the bridges are washed away. So what it means is that within that period of time, you will not be able to reach most of the people out there in the communities in the rural areas because the services have been cut off. The ophthalmic personnel cannot actually go out and risk their lives. So this is one of the challenges that we've also been facing.
In terms of challenges, I'll highlight 3 key challenges that we face in our work with eye health. Basically, inadequate human resources across communities or across the country. This is actually being, in a way, resolved through the specialist training program that the Ministry of Health is implementing to get ophthalmologists across the country, and that is something that we are supporting as OBIS in terms of supporting a residency training program here in Lusaka. As well as we're supporting the residency program and full support basically next year for the STP program on the Copper Belt. So this has been a challenge, and you go to communities where there are no eye health staff, and this actually does discourage people from accessing services.
The theme of World Sight Day for 2020 is Hope in Sight. This theme is very clear to us because we have been working to eliminate avoidable blindness in the year 2020. But as year 2020 has come, we have been eluded. But the fact that we have done so much work, we have hope in sight that soon our goal will be achieved.
One Sight interprets the 2020 global theme of Hope in Sight by unpacking it to a sub-theme, Stronger Kids, Stronger Communities. So in line with this sub-theme, One Sight will use a children's book which is entitled Through the Looking Glasses. And the book features stories about the power of glasses and clear sight, and it will be read in various schools throughout the country to send a message that is indicating that clear sight helps improve performance in schools and well as promoting safety and productivity for all. One of the goals of Vision 2030 is to promote increased proportion of rural households that live 5 kilometers from the nearest health facility. And One Sight has supported this goal by establishing fully equipped eye units in the remotest parts of the country.
As for Sight Savers, the 2020 theme, which is Hope in Sight, is a very exciting theme in the sense that 2020, we are looking at the Vision 2020, in which Zambia made a number of commitments that by 2020 we should be able to provide high health services for all. So it actually provides an opportunity for people to actually access high services which are much available. And we've actually seen a number of districts that never had high health within being able to have established clinics, so which means a number of people have been reached as we talk about Hope in Sight. In addition to that, we are seeing that as an opportunity to work with other partners, to collaborate with other partners, stakeholders, just to ensure that everyone has got access to high health, regardless of age, sex, it could be any disability. Everyone should actually access high health services. So this is quite an exciting thing. It gives us an opportunity to ensure that everyone has got access to high health.
At Vision Aid Overseas, we interpret this year's vision for World Sight Day, Hope in Sight, as, you know, a very important hope that we have as eye health practitioners, as eye health community. We are aware that over 1.2 billion people suffer with, eye conditions, which could have been, which could have been avoided, which is avoidable, But you see, with the effort and collaboration of all partners and stakeholders, there is hope that we can get the world to see. We can get the world to see and be economically productive, because when the world is able to see, they are able to have an income. When the world is able to see, the children are able to learn. So this theme is very important. There is hope.
This World Sight Day's call for action, which is hope in sight. Basically for us it means there is hope in sight. Right now we're going through a very difficult time with the COVID-19 pandemic. For us it's an opportunity to integrate. It's an opportunity for us to integrate eye health messaging and COVID-19 messages, and we're doing that through a number of radio programs that we're running both on the Copper Belt and in Northwestern Province, because we can't be there on the ground and work with the community health staff that we work with and also engage with communities. So basically we're using radio, and through those radio stations we're integrating our messages talking about COVID-19 as well as eye health. And after sometimes one of the symptoms of COVID-19 is conjunctivitis, which is basically the red eye. So hope in sight for us means that there definitely is hope in sight. And also, as we know, 75% of visual impairment is avoidable and treatable. So in a way, there is no need for someone to go needlessly blind when your condition can be treated. The main key message here is seek treatment. When you you realize you have a problem with your eye, you have to go to a health center, have yourself checked. And if you have diabetes, have regular eye checkups. That will help you. Definitely there is hope in sight. You don't have to go blind.
To you all, let's stand together in this fight to prevent blindness. Let's ensure those with irreversible blindness are not stigmatized. You and me can make a difference. Have your eyes tested today.
My message to the community for this World Sight Day is that there are many conditions that can be avoided, which you do not have to be blind with. And we must also know that actually if one blind person receives surgery or treatment, we offload into the community 2 people. Because every so often, these people that have a condition, they always have somebody to lead them. And when you free one person, that means you have freed that particular person and also the person that is always carrying them around as they go to do their chores.
As we commemorate the 2020 World Sight Day, our message is to encourage you all to go to the nearest health facility and get eye examination so that you obtain glasses in case you have a refractive error, and this will unlock your potential. Thank you.
So my message to the people of Zambia and everyone out there is that let's go and have our eyes checked. We only have one pair of eyes, and if you lose that pair of eyes, it becomes very difficult to replace them. So it is cardinal, it's incumbent upon every Zambian to ensure that you've got your eyes checked up. So let's stand up, have our eyes checked if we are going to lead a very productive life.
My message to the Zambian people ahead of the World Sight Day is that there is hope. Just as the theme says, there's hope inside. So the government, as stakeholders, and you the people, we are working together to make sure that the world can see, the Zambian people can see. Hope is inside.
So the message for this World Sight Day for Zambians is there is hope in sight. 75% of visual impairment is treatable. Go to the eye health center when you have problems with your eyes. You just save your sight.